Hi guys, we're back with sessions 29, and today the topic for discussion is when natural disaster strikes. Needless to say, we have just seen the impact of an earthquake on Haiti and the devastation that it caused. Now, there are topics that we are going to discuss which are relevant to what can happen when disaster strikes, even when it does not involve Haiti. And this is what this is all about. We're going to discuss the devastation of the impact, preterm labor, which can also result occurs as a result, of what happened in Haiti, the earthquake, people's immediate response to a crisis, the golden hour, airway management at the trauma scene, hypovolemic shock, hypothermia, spinal shock, sepsis, crush injury, head injury and intracranial pressure monitoring, and post-traumatic stress disorder. You can go to dearnurses.net and read When Natural Disaster Strikes. First of all, we know that very recently, this was on January the 12th, 2010, the unthinkable happened. Port-au-Prince, Haiti suffered a massive earthquake. We can see the rubble here, people calling out, here's someone calling for help. There's someone just looking very confused with two small children. We just see people standing, looking around in shock. People were not exactly prepared for this because this is not an area where earthquake normally happens. Lives were shattered, people were killed by, rubble falling on top of them. Some people were trapped. And there were even situations where 2 weeks later, people were still being pulled out of the rubble. Now, Haiti's devastation, this does not go away right away. And as we can see here, there is a lady shouting, "Help me, my baby's coming." Preterm labor can occur as a result. I urge you to go to dearnurses.net and read Simplifying Maternal Nursing to learn about such a topic. And we can see there are people injured here, bleeding. They did not have the immediate resources to treat such patients. But of course, like I said, it does not hurt to know what to expect and what you can do in a crisis. Now, post-traumatic stress disorder. Whenever there's been a traumatic incident, it might be a fire, a car accident, sexual assault, witness to a crime, or something like the earthquake that just happened. Some people have a difficult time coping. They are just not able to bounce back, and their ability to function is severely impaired. This causes a severe degree of anxiety to the point where they may have difficulty falling asleep at night. If you will remember, with those patients in Haiti, the people in Haiti, many of them were very afraid to go back into their homes. Yes, there were that percentage that their homes were obviously damaged and was reduced to rubble, but then you had that number of people who were just too afraid to go back. There were aftershocks which made it even worse. And of course, many times when there's a traumatic event, some people keep reliving the incident, like the slightest noise they hear, a bad dream, it just never goes away. So learn more about this topic by going to dearnurses.net. Now, there are a number of topics and videos that might be helpful for you to go along with this subject when natural disaster strikes. If you would go to dearnurses.com, there are related videos. I believe it's videos 7, 8, and 9 that are relevant to all traumatic injuries that will be a big help to you. Now, traumatic brain injury is also at dearnurses.com, and then understanding chest, abdominal, and spinal trauma. The aftermath of trauma and the complications and rehabilitation are all contained in dearnurses.com. So if you take the time to go there, you can learn quite a lot of trauma situations, which of course you never know when you'll need to help others. So have a nice day and stay posted for more clinical information. Bye.